Ketamine is a general anesthetic drug that has been used for general anesthesia for many decades. In the last 10 years or so, it has garnered a lot of interest as an antidepressant, and a very powerful one at that, using a very unique mechanism of action not known or used by any other drug until just recently, with a new version of ketamine called Esketamine. Ketamine is a fairly new treatment option. With the exception of Spravato, it is used off-label, so we don't typically go to it first line. We use more traditional treatment options, such as SSRIs, SNRIs, or psychotherapy before we look into ketamine. That said, ketamine is very potent and powerful and can kick in very quickly. So depending on the person's circumstance, it is something we may use early on as a part of their treatment plan. The reality is, it's fairly new and off-label, so we do use it cautiously and according to an individual patient's needs. Like I said, ketamine has recently been studied specifically in depression, but also has been shown to be helpful in acute suicidality. Furthermore, the mechanism of ketamine is working on a receptor called NMDA receptor. Modulators of that receptor have been found to be helpful for OCD and some other anxiety type disorders like PTSD. The most common side effects of ketamine are a little bit of sedation or upset stomach. There are a number of other possible side effects, including slight increase in blood pressure, but all those are managed and monitored appropriately by your healthcare provider in the office. Ketamine is a scheduled narcotic. It is something that can be found on the streets as a party drug, known as Special K. Ketamine does have the ability to cause euphoric or dissociative effect at high doses. However, low doses that we administered in a control environment, this is not an issue or complaint. There is a common misconception that something that causes euphoria also causes addiction. The reality is, this is not the case. Ketamine's effect has little to do with being in your system. In fact, it's in and out of your system very quickly. Therefore, tolerance, withdrawal, addiction are very unlikely to happen with ketamine. Ketamine has been used as an anesthetic agent for decades and has been proven to be safe and efficacious in that setting. In the last 10 years, it has been studied more and more in depression. And again, with the advent of esketamine, there's still a very strong safety profile for this medication. However, it does come with risks, and therefore it does have to be administered in a healthcare setting under the supervision of a provider.